Hey again, this channel is called Different Careers with Kate Nudd. Again, right now I am a licensed massage therapist, so we're going to go over a review again of continuing education class. It's MLD 1, Introduction to Manual Lymphatic Drainage, and Nicola McGill did it. I think she said she's originally from London and she came to the United States and she helped get other massage therapists into doing lymphatic drainage. So it was worth 1 CE hours. So this class took me about 1 hour and 26 minutes. Again, I was pausing the video to try to take notes. So let's see. Oh, what is this about? Okay. So manual lymphatic drainage, MLD, is gentle rhythmic form of bodywork that enhances and supports the movement of fluid through the lymphatic system, support health and well-being, developed by Danish therapists Emil and Astrid Voder in the 1930s. MLD is now practiced extensively by health and wellness practitioners and is used within the medical community to treat lymphedema and post-surgical and post-traumatic edema. Join Nicola McGill in this engaging lecture-based course to learn the benefits, indications, and mechanics of this gentle, effective modality. So, yeah. So it's like... yeah, so that's what it is. So the course outline was a lot. You go over lymphatic system functions, manual lymphatic drainage, overview of history, effects of MLD. I'm not going to read all that. Feel free to check it out at ABMP if you're interested in this. Learning objectives, do all that. So the instructor, Nicola McGill, has over 25 years of experience in this field of massage and body work, both in the US and the UK. She is a manual lymphatic drainage certification program instructor at the Close Training and Consulting in her clinical practice. Nicola utilizes her skills as an aromatherapist, massage therapist, and MLD practitioner to treat a wide range of chronic acute medical conditions, including those related to the respiratory, digestive, musculoskeletal, nervous, and reproductive systems. She is an oncology, massage, and lymphedema therapist at Boulder Community Hospital and a team member at the Boulder Cancer Survivorship Program at Avanti Therapy, where she provides lymphedema education and restorative and comfort-oriented bodywork treatments for individuals who are undergoing and have completed treatments for a cancer diagnosis. So if you want more information, you go to Nicola McGill, Nicola McGill, .com, and then theclosetraining.com. And theclosetraining.com, they have a system where I looked it up online, and you can do most of your training online. And then you have to go to Colorado for manual training to learn the hands-on stuff. But I think you have to do the book work first before that. And it is 135 hours of training to get that certification. So again, I mentioned it seems like super expensive because I looked and it seemed like it was around like $3,300 just to get all of those continuing education stuff. So a part of me would want to break it up because in New York State, you're required to do continuing education classes 36 every 3 years. So unless someone were to pay for my training for me, I would want to do it so every 3 years I could do about 36 credits. So that way I would get my money's worth. That's how I would want to do it. but I think it's like a 2 year thing. So that training would be 135 hours for just 3 years worth of continuing education credits. So you would be doing like drastically over the work, and that would be unnecessary. So like money wise, you're spending way more money to get certified in something. So I wish they could like break it up. So you'd be like, here, if you want to gradually learn this to get continuing education credits, here you go. Here's our long-term program. So that way you can afford it if you are not. Because as a massage therapist in New York State, we are paid by the hour. We are not paid by a salary. So to get certified in different massage modalities, you want to take classes that are more reasonable. So that way you can, gradually learn the stuff and manage your money better. So, because I also work in like a spa setting, you need hands-on training to do lymphatic drainage. That's what I learned from this video. So let's show a brief clip of this. Yeah. Here we go. That was like the end. I'm trying to find the techniques that she used. I don't remember where they are. Maybe it's here. No. Here we go. I'll back up a little bit. So, and maybe a little tiny bit more. So this is 3 strokes she used in lymphatic drainage.
And a rotary technique. And these techniques are all designed to follow the anatomy and physiology of the lymphatic system, each of them having the same kind of movements. They're basically perpendicular stretching of the skin. In the stretching of the skin is in the direction of lymphatic flow, so it's following the flow of the lymphatic system. The techniques, the stationary circle, for example, is a stroke that can be used on any part of the body, and it's using either your fingers or your hands and basically connecting to the skin, stretching it to its maximum skin stretch to allow the movement of that fluid into those lymphatic capillaries, and again moving it along in the direction of where we want that lymph to go, which is generally through the collectors and into your groups of lymph nodes. Pump technique is another one very similar, but there's a little bit more kind of movement, a bit more of a dance to your hands with it, where you're molding your hand around the roundness of a body part. So we use that technique, for example, on an arm or a leg. And then we have a rotary, which is again a flat-handed movement where we are following the direction of the collectors towards the group of lymph nodes, and it's a movement that we use on flat areas, i.e. the trunk, the back, and the lumbar and gluteal regions. And all of these strokes, even though they may have different names and they have different hand placements and the way that you do the work, the thing that they have in common is that they all have this pressure phase and a relaxation phase. And the reason why these two are so important is because your pressure phase, again, coming back to physics, wherever you apply pressure, you get movement. So a pressure phase is where you get the movement of the lymphatic fluid, and then that relaxation phase allows for the refilling of those lymphatic vessels. So it's like it's causing this vacuum and distension of the vessels and causing this vacuum to allow the refilling, and then obviously when it refills there's more fluid to move through, and these lymphangions will contract more frequently. So that's kind of the basic introduction into what the techniques are. And a lot of the time when we're working on body areas, we combine the techniques. So you may have an instance, for example, when you're working on an arm, on the upper portion of the arm, you're using a pump technique, then you're following through with a stationary circle, and it is a real it is like a dance. It's literally this flow of constant movement, and it's quite rhythmic. Our hands move at a rate of about 1 per second, and we apply the techniques probably at about 5 to 7 times in an area.
Yep. So, I did find this class kind of informative. So this time around, because she's like an instructor, and it seems like she actually teaches like the strokes, like I think I was able my intention she was able to grab my attention better through this class. And so, like, the way she talked in a way where I could understand what she was saying, so I was able to pass the quiz the first time around. And she did catch my interest, where like she was very informative about like the benefits of lymphatic drainage, how it actually helps support the cardiovascular system and supports the nervous system. And she made me understand like it just doesn't support the immune system. And she mentioned how like there was a bunch of different possible diseases that it could help and be very beneficial for getting lymphatic drainage. So because like a lot of people, they think light pressure doesn't do anything for your massage, you're not going to get any benefits to it. But she talked about how like if you have fragile people that can't handle like the deeper pressures of massage, it's very soothing, it's very relaxing, it's non-invasive. It's gonna help people get their lymph flow moving. You may have to do shorter treatment sessions, so like this would probably be perfect for people like, I don't want a 60-minute or 90-minute massage. I may only want like a 30 minutes or 45 minutes or something. Like this would be better for them. And then she was saying like she did have students on the table where some students, they feel energized after they get lymphatic drainage, and then she said some students felt like wiped out after getting lymphatic drainage, because the lymphatic system is dealing with like getting rid of toxins in the body. So if you're not doing stuff to have good lymph flow, then you're gonna feel wiped out, and you could feel like more of a negative reaction to the massage. But it's like it's not necessarily a bad thing that you got like wiped out. Like this is just my understanding is like the immune system. If you got blockage or your lymph isn't moving at a good rate or something, where you're getting backed up a little bit and you need help, you like if you're releasing toxins because like you're getting the lymph flow moving, you could feel a little bit worse before you feel overall better. That's like my understanding of like the immune system and stuff like that. So I felt like this class was very informative, so I will give this class a rating of a C. Like part of what goes on into my head with some of the ratings is when you do the survey questions at the end of a class, it keeps asking, would you use this in your practice? In New York State, you have to get certified to do certain things. You can't just watch a video necessarily one time, learn the technique from a video depending on what it is, and just automatically put it into, incorporate it into your massage therapy profession. So so I felt like overall the information was good, but again, it's taking me an hour and 26 minutes for one CE hour class. So that's why I got a rating of a C, which is like better than everyone else. But like the survey, like put that thought into my brain. I should be able to use this stuff from this class and automatically put it into my massage therapy profession, which I can't do. And so like if I incorporated any of like the massage techniques that she used, I would have to like modify it and be like, how do we do this in a Swedish style? So like the circular strokes, like I don't understand how to really do the okay, you apply pressure, then you relax and you pause. Like that seems like to get the stroke flow like systematically, you really need that instructor to teach you. So I could incorporate like, oh, like try to do circular strokes, try to do like a vertical, like you're going up towards the heart, try to do just light strokes up towards the heart, try to do those like light horizontal, I mean that goes like width wise, like in a light way, in a Swedish style, but I'm not gonna like actually technically use the lymphatic strokes, but it gave me ideas to incorporate it in a Swedish way. So I can't really use it because it's like I would need an instructor to teach me the hands-on stuff to really learn how to do lymphatic drainage properly. And it sounds like there's more techniques to learn. But if someone were willing to pay for the class for me so I could learn it, definitely she made me more interested in wanting to learn this technique because it does seem very soothing, relaxing. And she said it can help with if people have like nerve pain. It like she said it helped people and like get rid of their pain. And if anyone has an autoimmune disease, like this is the lymphatic system. The lymphatic system is like the thing that like supports the immune system like hardcore. Like it works with other systems in the body, but it's like its primary focus is like to make sure your immune system is like up to par. So like I don't understand why people who have an autoimmune system disease aren't like screaming to every spa place or even like private massage therapists, please get lymphatic drainage training. I need stuff to support my immune system because I need extra help because if you like it probably would help them with their diseases better because they have like an autoimmune disease, so they need extra help with something that supports the immune system or the lymphatic system or lymphatic drainage. I don't know. Anyways, that's like cause and effect. So I hope you enjoyed this review. If you have any questions concerning massage therapy, feel free to put them in the comments section below. Until next time.